Hi everyone, thank you for taking the time to view my poster presentation titled Outcomes and Satisfaction in Northern Ontario Ambulatory Plastic Surgery, a Quality Improvement Study. My name is Emily PynnE and I'm a second-year medical student at Nosum University. This project was completed in collaboration with Priyanka Azad under the supervision of Dr. Azad. I have no conflicts of interest to disclose and this project did not receive any financial support. To begin, ambulatory plastic surgery has emerged as a safe and efficient alternative to hospital-based care, especially in underserved areas like Northern Ontario. This study evaluates the safety, feasibility, and patient satisfaction associated with high-volume procedures performed in a single ambulatory clinic. Our objectives were to assess short-term outcomes of ambulatory plastic surgery procedures, contribute to the growing body of evidence supporting ambulatory care models, improve access to high-quality surgical care in underserved areas, and show that these procedures can be performed safely outside hospital settings. So we conducted a retrospective review of ambulatory procedures performed from August 2023 to August 2024 at one plastic surgery clinic in Thunder Bay, Ontario. So procedures at this clinic included soft tissue excisions, such as skin cancer or benign lesions, minor hand surgeries such as carpal tunnel and trigger finger release, reconstructive procedures such as scar revisions or nail ablations. We collected data on patient factors which included age, gender, medical history, smoking status, the use of blood thinners and the referring provider, as well as surgical outcomes which included procedure type, complications, and urgent follow-up visits, which was classified within 2 weeks. Additionally, a patient satisfaction survey assessed perceptions of professionalism, communication, and overall experience. So for our results, there were 505 patients included in this study, aged 16 to 100 with a median age of 64. The gender distribution was fair, including 246 males, 258 females, and one unspecified gender. Most referrals came from general practitioners, with some coming from dermatologists, general practitioner dermatologist, nurse practitioners, and physician assistants as well. 35 patients returned for urgent review within 2 weeks, and 23 of these had confirmed complications. In total, 41 patients experienced complications, which is 8% of our study population. 21 were male, 20 were female, 13 were on blood thinners, 4 were current smokers, and most were in the 70 to 80 age group. The most common complication was infection, followed by irregular healing and wound dehiscence. This varied by procedure. Punch biopsies had the highest complication rate at 11.6%, whereas carpal tunnel release had a much lower rate at 1.5%. We identified a spike in punch biopsy complications in early 2024, which we traced back to the use of silver nitrate for hemostasis. After switching to sutures, post-biopsy infections decreased significantly, highlighting the importance of regular protocol review. Regarding the patient satisfaction surveys, there were 50 survey respondents. 96% were satisfied with the quality of care, 94% with staff professionalism, 92% with clinic efficiency. Qualitative feedback praised the welcoming environment and easy access, though some patients suggested clearer post-operative instructions. Overall, our 8% complication rate aligns with existing literature on minor procedures and supports the safety of ambulatory care. Certain subgroups, including patients on blood thinners, smokers, and older adults, were more likely to experience complications, consistent with known risks like impaired healing, impaired bleeding, and higher infection rates. The low complication rate specifically for carpal tunnel release supports office-based surgery as a viable way to expand access to this commonly needed procedure. Referral patterns highlight strong healthcare integration, with general practitioners serving as a key access point to efficient, diverse ambulatory procedures that improve care in underserved regions. High-volume ambulatory procedures can be safely and efficiently performed in office settings, offering benefits like reduced wait times and improved accessibility, especially critical in Northern Ontario. Strength of our study included a large sample size, real-world data from Northern Ontario, and procedural improvements. Limitations include a single-center design, lack of long-term follow-up, and potential patient satisfaction bias. This study supports ambulatory plastic surgery as a safe, patient-centered model that improves access to care. Future research should explore long-term outcomes, cost-effectiveness, and conduct comparative studies to assess broader applicability. Thank you very much for your time, and I hope you enjoyed this presentation.